Good morning, everybody. Wisconsin's 25th District Senator Romaine Quinn is our very special guest today, Thursday, May 25th, 2023. Special thank you to some of our guests so far this month, including Spooner Police Chief Mike Kronberger, Amy Loudenbeck, who was Kirk Anderson's very special guest on the Kirk Anderson Show, which he does on DrydenWire once a month. 7th Congressional District Representative Congressman Tom Tiffany, Director of Commercial Sales for Mosaic Technologies Joel Zimmerman, and of course Barron County Sheriff Chris Fitzgerald, as he co-hosts with me our weekly Positive Tuesday with Ben and Fitzy show. You can watch a recording of those and all of our previous live shows on our website at DrydenWire.com, right here on our Facebook page under the videos tab, or just go to our YouTube channel. It's probably faster, just youtube.com/DrydenWire. But today we welcome back for our monthly chat Wisconsin's 25th District Senator Romaine Quinn. Romaine, good morning.
Morning.
How are you?
I'm doing good. How are you today?
I kind of forgot that it was Memorial Day weekend coming up. And yeah, so I don't really have a ton of plans. How about you?
Well, of course, we have events all across the district.
Oh, right. You're a politician. You have to go kiss babies. And are there parades and stuff? Do they do parades on Memorial Day weekend?
I think some smaller communities might have them, but a lot of times it's events gathering around cemeteries, and every community's got them. So
right.
At Spooner, our veteran cemetery, the state cemetery, up by Spooner, beautiful. They have their service on Saturday, and then Rice Lake does theirs Monday. But I know there's services all over the district, which is
right. Great. Yeah. Duh. Of course, it's not. Whatever. And good morning. Hey, Representative Gay Magnan Fiji is watching this morning. Good morning. Okay. She says Ben, but then says Senator to you. It's not Romaine. It's just Senator. Oh, good night. Hey, and Mike Schaefer is watching. I was just talking right before we went live. I just referenced him. What's that?
Gay's called me other things before.
Don't put that on the screen, Gay. Now, come on. Yeah, and actually, Mike may want to be interested in this. I talked to him yesterday, and that's one of the things I want to talk. Oh, shoot. You know what? Can we just get right into it?
Whatever you want to talk about.
Yep. I wrote down a couple of talking points.
It's your show.
It really isn't. It's yours. But there is an op-ed. So there's an embargoed housing report comes out at 9 o'clock. So I can't technically really talk about that until like 9 o'clock. But sure. I want to ask you kind of about housing and what role legislature can play in this. Is this something that you guys can do? But first, a couple of days ago, we had an op-ed that was sent to us, and the title was, and I think I even have a photo, this was from Alyssa Powell, Beyond Barriers, Why Nursing Scope of Practice Reform is Needed in Wisconsin. Alyssa is a pediatric nurse practitioner with over 10 years experience working in Wisconsin healthcare and is an advocate for healthcare and education policy reforms. And I'm just going to read just kind of that brief first part, which is why I wanted to bring it up to you. And in her op-ed, it says, when it comes to healthcare, Wisconsinites deserve a personalized approach that delivers more choice, control, affordability, and quality from the medical professionals we trust. The Advanced Practice Registered Nurse Bill makes a giant step in the right direction. Then she kind of walks through all of this stuff regarding APNs in this bill and et cetera. I'm not going to lie, I didn't really understand a whole lot of it, which is why actually I called Mike yesterday and said, so what is this? And apparently this bill, which I think you were a part of, I don't know, co-author, co-sponsored, or something happened yesterday at 3 o'clock, so I kind of want to tie this all in together. So for people who don't know or didn't read that article, what is this about? And then what happened yesterday at 3 o'clock?
So this bill goes back quite some time, and it's a greater conversation to start having about how we provide primary care across the state. We know that in Wisconsin, particularly Northwest Wisconsin, we have some of the highest healthcare costs, not in the state, but in the country. And so part of this bill is trying to allow practitioners to operate their own clinics or exercise, their practice outside of a typical setting in a hospital, right? So if a nurse practitioner wants to go open up her own clinic or his clinic and start seeing patients outside of a system, right now they legally can't do that unless they have a collaborative agreement with a doctor or a physician. And so what we're saying is nurse practitioners and the various specialties they have, I think they're more than qualified and competent to be able to operate on their own, up to the scope of their practice. And so this bill wants to allow these nurse practitioners to not have to have a collaborative agreement. Because what we found is in many cases, they have to get a doctor to sign off. They'll never talk to the doctor, maybe once a year, and they'll pay the guy $1,000 a month. I think we heard from the one author over in Tomahawk that there's a doctor in town that's making almost six figures between four nurse practitioners who operate and pay him to have a collaborative agreement. And so it's just a barrier to healthcare. It's a barrier to access. And we're pretty fortunate. There's a doctor, I can't recall her name. She's got her own primary care clinic up in Birchwood, which is great. She can do that. She's a physician, so she doesn't need a collaborative agreement. My cousin, Raquel's cousin, operates a clinic in Barron. She's a nurse practitioner and has, I think, two or three other nurses on her staff. She has to have a collaborative agreement to offer the same services, even though in a hospital setting she's qualified to offer those services. But according to our logic right now, she's not qualified if she's in her own building. So I understand that there's, we've always had this team-based approach to healthcare. When you're in a hospital setting, you get the best of everything because there's a doctor down the next office for expertise.
Yeah.
But all we're talking about is primary care. You're not having open heart surgery in a clinic operated by an APRN. And so we just want them to be able to practice and work up to the scope of their license independently without a collaborative agreement with the physician. And so yesterday there was a hearing on the bill. And so there's like jockeying back and forth. Do you have to do it for 2 years and then you can go on your own? Medical Society representing physicians said 4 years. Right now I think there's 27 states in the country that don't require a collaborative agreement, or it's a 2-year wait. The doctors in Wisconsin want a 4-year wait. And so I actually jumped up to that hearing yesterday, and they were just grilling this guy from the Med Society. It was pretty funny. Basically just, how did you come up with 4 years? Or show me the data that patients are under greater risk of getting poorer quality of care when they're in a clinic with a nurse practitioner in other states that don't have these agreements. And there's never an answer. There's never a study. It's just, unfortunately, I think for some, it's a monetary thing. And then I think some, they don't want the competition. And then I think some are sincere. They're worried about the patient. So it's just trying to thread that needle and allow practitioners who are competent and licensed to operate up to the scope of their license, but independently on their own.
Okay, so we're talking about what they would be able to do, but from not consumer, a patient. How does this benefit them? Like me or you or anyone, just the average person or anyone watching right now going, wow, if this all came to fruition, that would actually help me. How? Like, how does that benefit anybody?
So right now we're fortunate we do have some access. I think there's a primary care clinic operated by a nurse practitioner in Rice Lake. Like I mentioned, my cousin operates one in Barron, and there are some in other parts of the state. So what they offer is, let's say you have really expensive insurance with a high deductible and you can't afford it. You can go in and see them and pay cash. I think your first visit's like $125, and then after that it's cheaper. And you can walk in anytime for any reason and directly see this practitioner who will work with you. Now some operate them as almost like a gym membership. You pay $80 a month, and then you can go in and see her or him whenever you need health care. And so, like, even for us, we go to Mayo Clinic. If I went into Mayo Clinic, I'm guessing it's going to cost me $300 and some for a strep test. I could go in for $80 and get a strep test from this nurse practitioner that operates her own clinic if I'm paying cash. So it's just another way to provide a lot of your primary care in a different setting and possibly cheaper. And so I think it creates competition, healthy competition. I think it's good for patients. It's good for consumers. It gives people options. And it gives you that quality of care. So instead of me, I go in to a medical setting and I see I can't remember the name of the person that checks you in. The doctor will come in for 3 minutes, and then you spend the rest of the time with the nurse anyways, right? What's your billed for your time with the doctor, et cetera. Well, here, your nurse practitioner is your doctor, and you get that one-on-one time with that practitioner. So I think it's kind of almost old school in a way, going back to kind of how medicine used to be with a family doc. You get that care, that time with that person. So it's not for everyone. They can't offer the services that every hospital setting can. I just think it's good to have a good mix of options on the table for consumers, and that's what this bill allows.
What is the pushback? What's the other, I wouldn't say other side, and I don't know, is this like a Republican thing or because it always seems to be that way, but hopefully maybe not. I don't know. But wouldn't say even necessarily the pushback, but what's the concern from the other side? The other point of view saying, okay, this is good, but I got a couple of concerns we may need to address, or because anytime you solve one problem, it seems like it creates another one. What's the pushback or the concern from the people who are not for this?
So I think what we hear from some of the physician groups is that they fear that if there's a more complicated situation, that a nurse practitioner could miss something, and then if there was a doctor on call or a doctor with an agreement that they could call, that maybe there'd be better outcomes for that patient. Could a nurse practitioner can't do everything a physician can,
Right.
and so could we miss something if you're not in a hospital setting with team-based care, where I can walk down the hallway and see the specialist and say, hey, this case is a little different. It's a little beyond my scope. Could you come take a look or check in on this patient for me? And so I think their fear is for the patient, but there's some merit to that. But again, any nurse practitioner that has, their license, they're not going to practice beyond the scope of their own ability, right?
I understand.
If they're already going to refer you to a specialist. They're already going to refer you to a physician or someone with the expertise where maybe they need to call. So I think there are nurse practitioners out there right now with good collaborative agreements with a physician that wants to do the right thing. And there are a lot of physicians out there that just sign a piece of paper, say, I'm the collaborator, and they don't even talk to them ever because the nurses don't need them. But they have to pay them hundreds of dollars every month for this agreement that the state says they have to do. So we got to find a balance between, are we actually protecting patients, or are we protecting, is it a turf war? I think in an age where the cost of medicine and healthcare continues to rise, having more practitioners operate and offer primary care services, which I think if we invested more in primary care, we would see greater returns in the back end. We can prevent the heart disease and other issues long term if you get the care up front. And that's what we're hoping you can do by offering this type of setting for more people.
Where does the hospital association stand on this?
I think they had some concerns with the bill initially. I don't know the answer to that. I know the physician groups like the Med Society are obviously opposed to it, but I don't know where WHA is.
Okay. And is this, when I was talking to Mike Schaefer yesterday, I think he had mentioned that this, he believed, has already come up in the past.
Yep.
And maybe even passed or like gone through the whole process. Now, I don't know this. I don't want to put this on Mike because I can't remember if it was Mike that told me. But it went through something already, and then the governor had vetoed it. Again, I don't know how accurate that is. I can't remember who it was. I think it was Mike who had mentioned that, but I can't remember.
Yep.
Has this come up in the past? What you guys did yesterday, or this bill, has this already been addressed, or is this the first time it's going through?
So I was a co-author of the bill when I was in the assembly yet.
Holy cow.
Yeah, we're 6 years in the making, 5 years in the making on this, but there's just such resistance. And it's funny because there's a nurse practitioner that was in the assembly. She ran the bill. She came in when I left, and then she ran for state senate. And if you go and look at the campaign finance reports from her opponent, it is littered with donations from physicians because they wanted to pummel her, because they did not want her in the Senate advocating for a bill for her profession. And so the politics behind the scenes are a little ugly too, which I think is unfortunate. But yeah, so the governor did veto the bill. It was passed. I think last session he vetoed it. Then he had language in his own budget that did something similar, but not quite as far. And it actually took nurse anesthetists backwards. They already operate independently, and then it would make them tie their practice to an anesthesiologist. And so that's just a non-starter for people. I mean, it's going the other direction. So there's a lot of back and forth. We'll see what happens. But I think we passed the bill. We sent it to the governor's desk, and then I think we shoot for an override. We've got it in the Senate, and I want legislators to have to go back home and tell their constituents why they don't think a nurse practitioner who is licensed and qualified should be able to offer you and your family care in her own clinic. You go tell that to voters. And so I think that's the conversation we should have.
All right. Let's move on to the only other thing that I had written down, but now I can't find where I wrote it down. And that was at 9:00 this morning. There is the April housing report that's going to be published. We have it ready to go. I can't publish it on a website until 9, but I can't do it while we're doing the show. So as soon as the show is finished, I'll hit the button that will publish this, and it's the report. So, and I don't know where you are, and that's kind of what I wanted to get to is where can you, or if you can, from a legislative standpoint, do anything about this stuff. But also, your part-time gig is also being a realtor. And, because most legislators have a part-time job, like teachers, nights, weekends, summers, etc. So from just your other job, how is the housing market right now? And then is there from your main job here as a senator, is there anything you guys can do? I mean, is it going well? Is it not going well? And is there anything you guys can do where it's like, yeah, no, that's not how it works. Economy, that stuff's somebody else's business. We can't pass a bill. So how does that work?
Yeah, no, so to set the stage, we have a housing crisis in the state. It's a housing shortage. It is now in every community, in every size community, and in every wealth, age group, you name it, right? So it's a good thing because now it has the intention of the entire legislature versus I think it was more keenly a problem in rural areas. So now this isn't a rural, urban, suburban issue.
Can I
There are not,
interrupt you real quick because I don't want to forget this? Uh, uh,
yep.
how did we? Why do we have a statewide? How does this happen? I mean, houses just don't like go away, right?
Right.
So what causes this?
It really is a perfect storm that collectively has all come together. I think it goes back to the recession in '08. We saw a lot of contractors go belly up, and they never came back to the profession when things got better again. And so we are not building the homes we used to keep up with the demand.
Okay.
And then you have a low interest rates. Now people are trying to move up a step. If I can get into a 30-year mortgage at 2.5% instead of a $200,000 home, I could maybe afford 275 for the same payment. And so now everyone's trying to go up a step at the same time, and it's creating this enormous amount of pressure. And then building costs go through the roof. We have inflation, and so now the person that was going to build a $500,000 home, it jumped to 700,000. Well, I can't afford that. So now instead of building, I'm buying a home for 500,000. And now that $500,000 house is not on the market for the guy that could barely afford 500. And it creates this downward pressure in basically every category. So, perfect example, I had a house in Hagen for sale a couple months ago. Nice little place, 3 bedroom, 1 bath, just on the edge of the village for, gosh, I think it was 169,000, which 5 years ago it probably would have sold for a buck 10, a buck 20. And I listed on Friday, and we had 10 showings, 4 offers, and it sold for $10,000 over asking price by Sunday afternoon.
Wow.
And so, what does that tell you? That the demand is great. Interest rates are up, and there's still the demand. And I'm happy for my clients, my sellers. I'm happy for the buyers. They're also my clients. But I know there's 9 other families out there that needed that house. There are
Right.
9 families, elderly people, people with kids, that are in a situation where they needed that home. I could have sold that home 10 times that weekend. And so the need is there. And this is in Hagen, not Eau Claire, not Superior or Madison. It's everywhere. So we can do some things, and that's why I'm excited.
Oh,
So I am chair of the Senate Committee on Housing, also Forestry and.
all right. I feel like I should have
Um,
known that.
right,
So, I'm like, can you guys do anything? Like, well, I'm the chair of the.
yeah, we're
Yeah.
going to do something. So
Clearly, I don't do my research before these shows. Sorry.
no, I want to give a shout out to Representative Rob Brooks. He has been working. He's from Brookfield. He's been working for a long time with the Wisconsin Realtors Association, Wisconsin Builders, and all the groups that care about the cost of housing and lack of housing. League of Municipalities, Towns Association, Counties Association, on trying to get to the root cause of we don't have enough housing stock. So what is a barrier today, and specifically housing stock that's affordable? We need more homes for teachers in our community. We need more homes for police officers and firefighters. The 3, 4, 500, $600,000 homes are great, but I need that 180 to 250, where someone coming out of college gets a good job and they can start a family and set down roots in Rice Lake or Ashland or Superior or Park Falls. And we just don't have that. In today's world, builders can't build those homes because there's no margin. And so we have a whole package of bills we just heard last week to address that. First bill deals with infrastructure. Right now, sometimes in some communities, I reference Rice Lake because I work with Dave all the time. He's got a project going on by the Red Cedar Church. By the time you put in the road, the sewer, the sidewalk, the lights, etc., you're almost at $50,000 to $60,000 a lot when you spread the cost out. Now, how do I build a $200,000 house when I've got 50 grand into the lot before I even turn over any dirt? You can't do it.
Mm-mm.
So if a community doesn't have any TIF room to put that in for the developer has to pass it on the cost of the house. And so the particular bill in this package that I drafted would offer zero interest loans to developers for infrastructure, because we know infrastructure is a big impediment to development.
And the infrastructure would be the things you were talking about, the roads and all that stuff. I've heard that word TIF before, but I don't. Maybe that's a whole other conversation. But what does that stand for?
Tax increment financing. And so, in a quick nutshell, a community can create a TIF district, and then all the property taxes collected in that district can be used for infrastructure. And so, for instance, Rice Lake, I believe, has the TIF where all the twin homes went in along Moon Lake. So they borrowed against the TIF to put the money to get the road in, to get the sewer in, to get the water in. And then as homes are built, those property taxes will pay the loan back. And then when they retire the TIF, when the loan's gone, all that money now goes back into the general fund. But the problem is some communities, we cap TIF because we don't want communities to go so far where they build all these roads, no one comes, and they go belly up. And so we don't want too much TIF in the community. But if you don't have TIF room, you're screwed because no one has the money to put in the streets or like I said, the sewer, water, the lights, sidewalk, curb, and gutter. And so one of the bills will get at that. There's actually pieces of 6 bills. Another one is zero interest loans for people to rehab opportunities for apartments in downtown main streets. So if you walk down downtown Spooner, I guarantee you that there are former apartment living spaces above these buildings, second story, third story, and they're probably dilapidated. They're probably just used for storage. They're probably abandoned by the building owner. And they could be downtown apartments that would revitalize our downtowns. It brings people downtown. It brings wealth to those small businesses. And so we want to do zero interest loans for developers that go onto the second or third floor in our downtowns across Wisconsin and open those back up for renters. And they would be affordable because not everyone wants to live above a bar. But if I can make the financing work to redevelop that, maybe I can offer it in a rent that's comparable for those who maybe can't afford a whole lot.
Got it.
Another bill, I don't know how deep you want to go. Another bill.
Well, you said there's like parts of, you said something about 6.
6, yep.
Yeah, so we're through 2, right?
So the third one would be the redevelopment of commercial properties. So let's say you have an old Shopko, an old Kmart, an old Walmart even. This would be infrastructure loans to either tear those buildings down and start from scratch and allow you to build housing there, or to redevelop that actual building. So maybe I can sub in a bunch of condos or apartments in an old Shopko building to offer up housing in a downtown setting for people. So there's that component as well.
Okay, hold on. So far, those first 2 were benefited. Well, it benefits everybody, but they were really directed towards developers. So now this one would be if there is a vacant building, which they're all over the place in your district, in which your district is our coverage area as well. We see these all over the place. It's unfortunate, but it is what it is. Some small, there are a few big ones. But would that be like if it's a small location where like a citizen, a person could take advantage of that? Or nope, that one also is just for a developer for that?
Well, anyone can be a developer, right? But
I don't know.
That one in particular, like a commercial setting, it's going to take someone with some deep pockets to do that.
Sure.
But I know a lot of people downtown on main streets that they own their buildings. They have their storefronts, they own their buildings, and they don't use the upstairs. They could absolutely qualify for this loan to do that themselves. It doesn't have to be a third party, a separate developer. These small business owners could reinvest in their own properties and offer that to people at an affordable rate. Because the key is, in all these bills we're talking about, it's tied to affordability. Because I do not want to subsidize an industry that outprices people, right? We already have enough of that. I want workforce housing. I want housing available for our families to middle to low income that can live in our communities and work and run our businesses and make us all thrive. Because right now, we just don't have affordable housing stock for them. And so, yeah, it's not just for developers, but I mean, anyone can kind of be your own developer.
Okay, well, there's the first 3. What's next?
And then we also have one, which would go back to your point on people. It would help them with loans to save the homes they have. And so it's rehab loans. So you could get a zero interest loan if you're of modest or low income to rehab your house to make sure you keep it in great shape. So, because as we need more houses, we got to make sure we don't lose the stock we already have.
Right.
And we already can go through communities. And as the former mayor, I mean, you deal with these, you have to condemn homes, you tear them down, you charge the property taxpayer back. But if I could have helped you put that roof on 15 years ago, that house might still be here today. And there's a family living in it.
Yeah.
And so, how do we stop the bleed while we're trying to expand housing stock?
Got
And
it.
so that one's important. And that one will also go, like I said, to homeowners, not developers, to help
Nice.
them with that. The one of the most important pieces to all of this is actually that we call it the NIMBY bill or anti-NIMBY bill. It's NIMBY stands for not in my backyard, right?
Oh, right,
Everyone
right,
wants everyone wants this amenity, but not by me.
right.
Everyone thinks we need an apartment building, but I don't want to live by it, or I don't want those people by me. I've heard that in committee, or even in my own caucus. We don't want those people in our community. So what we want to say is, communities, you can set your own zoning, you can set your own standards of how big your lot should be or shouldn't be. But if a developer comes in and proposes a project, twin homes, an apartment, single family homes, you don't get to move the goalpost on them anymore. If a neighbor comes and complains and says, I don't want this here, but the developer met all the requirements according to your own rules, you have to approve it. And so
Are,
this bill would create certainty for developers.
are you saying that
This
that's what happened? Like all of a sudden somebody comes in and is like, just move the line. Like we'll just move the zone and haha. Is that what
Yeah,
you're really that happens?
all the time. For
Crazy.
example, I think it was in Tosa, maybe Wauwatosa. There's a developer that came in and wanted to build, I don't know, a couple hundred apartments in a I think a 5, 6 story high rise setting. And so the community kept saying, no, we want bigger square footage or less apartments, and kept whittling the project down to the point where it wasn't going to cash flow. So he said, screw it, and built a car wash. So you had an opportunity for 200 and some apartments in your community, but your local people on the planning commission, because right, some neighbors called and complained, even though that project fit in the zoning, it was killed due to local people pushing back. So
That's fantastic.
there should be local input. Communities still have control over the rules they use, but we just want to say, hey, when you set your rules, can you follow them?
Yep.
Um,
Just
I
do us
think
a
that, I
favor. Come on.
think
Right.
that's more than reasonable.
All right.
So that one is really important because it sets the stage really for everything. So we talk about the cost of development, incentivizing developers, getting them to come to rural communities. They have to have the certainty to know that these projects are going to get done in a timely fashion.
Mm-hmm.
Was that four? Or we have
That's. I think that was the fifth one, wasn't it?
fifth one? Yep. And the last one is the LIHTC bill. So LIHTC is the low income housing tax credit. And so what that does is disincentivizes developers or gives them a tax credit for building affordable apartments for people at rates that they can afford. So it's income-based apartments, not Section 8. That's different. So as an example, and the program is overutilized right now. We spend $42 million a year in tax credits for these projects. Washburn, little community up in Bayfield County, put in for a project for 56 units in their municipality. They're about the size of Cameron, 2,000 people. But what we're finding in Washburn and Bayfield is that wealthier people are coming in and buying up all the single family homes and Airbnb-ing them out. So local
Ah.
people, local workers don't have an opportunity to stay and live in their own community. So they need housing bad. So they applied and their project was not awarded. And so that community is devastated. That 56 units, a combination of senior housing, low income housing, even market based housing, rentals, would have been a game changer. It really would have changed the trajectory of that community for the next 10 years to have those people be able to move in, stay, and work and live in that community. And so that's frustrating. I already talked to WIDA about that. WIDA is the one that awards these tax credits.
Hmm.
If I draw a line across Highway 8, there was not one project north of Highway 8 in this last awarding cycle. So that's why I ran. So I'm not very happy about that. So we're having conversations now, Director Vita and others, to say, how can we make sure this really is focused on reaching every community in the state, especially our district? So our bill takes that program from 42 million, bumps it to 100 million. We more than double it. And so we will more than double the units we're creating every single year for people across the state.
So this is
So
all in one bill. You had 6 things here. These 6 different things, or just one bill?
6 bills.
6
Yep.
bills. And we don't have to necessarily go through where each one is necessarily, but what's next for like the bulk of these bills? Where are we in that process?
So I heard them in my committee last week. Now we're working on some final technical amendments, details, and then I hope to exec them actually next week.
What does that mean?
We'll vote them out of committee. And so once they get out of committee, then they go to the Senate president and they can be referred, or not to the Senate president. They go to the Senate president to get referred to my committee. Then it'll go to our leadership team and they'll decide when to schedule it for a floor vote. But we still have to make sure we have the votes to pass it, right? So I might have the votes in committee, but now I have to go to all my colleagues and say, hey, let's sit down and talk about these 6 bills. Do you have issues? Do you not? Frankly, if you did have issues, you should have told me earlier because we've been working on this for 5 months.
Right.
Thought about it. Some people wait to the last minute to throw bombs into negotiations, but
Sure. Well, that's interesting. So, yeah. I didn't see that on Schoolhouse Rocks. I didn't know about that part.
No.
Do you think that will be, if everything works the way you want it to work and if everything goes smoothly, is that something that's going to be addressed this year?
Absolutely.
Okay.
Yeah, it would. We're doing it in context of this budget. And so the only other key piece is how much are we going to spend on some of these? The great part is we have a lot of one-time money, and these programs are revolving loan funds. So they're not grants. So as a developer, let's say a developer needs $1.5 million to put in streets in Spooner for development. They will slowly pay that back. It goes into the fund, and that $1.5 million will go out the door for the next project somewhere.
Beautiful.
And so we have a huge opportunity to sink one-time money, which we have a lot of, into a fund that will continue to perpetually build houses that are affordable for families.
Oh, that's nice. So it's not just one-time money where you just take it and use it, which that's perfectly fine, and then it runs out after 1 year. Fine. That's whatever. But this is one time, and then it should, in theory, or according to, it could just keep going without having to put any more into it. Unless you wanted to, of course, but that's fascinating. Do you think it's going to get done, any of this stuff, or is this going to be another, no, we don't have the votes, or we had the votes and then veto? Is this something that everyone can kind of get behind?
Yes, I think we worked really hard to try to bring everyone to the table, and if some don't like it, to make them neutral. Like, you don't have to like the bill, just don't oppose it, please.
Yeah.
So I think we're in a good space. We're in a good spot right now.
By the way, Airbnb. Have you ever stayed in an Airbnb? Because I refuse to. That's disgusting.
I have not.
No, that's disgusting.
No,
I mean, I go to hotels, like Drew and I will go away for like a weekend every once in a while, and I'm sure they're probably, gross too or something, whatever. But I don't know. Like being in somebody else's house is just really, really creepy. And I don't know if they have cameras in there and they're just like, I don't know. The whole idea is just, no thank you. All right, let's get to some more things that you are working on down there. Let's take a quick 15-second break. We'll be back after a word from Spooner Health.
Satisfaction surveys and in conversations with patients, they appreciate the fact that staff got to know them. Staff really took their preferences into account, and they just feel grateful that they are being cared for as a person.
To learn more about our services, visit SpoonerHealth.com.
See, I remembered that time. Not like last month. You had to remind me like 5 minutes of the show was over. Isn't that supposed to be like a career? Oh, sorry about that. All right. Oh, you still there? Yep. We can't hear you. Did you mute? Guest has muted themselves. What? I don't know. There must be a button on your screen somewhere that says mute. Can't hear you. No. Hit the hang up button and just sign back in. Oh, man. That's so crazy. We've never had that happen before. Hey, there we go.
Better?
Yeah. I don't know what happened.
I don't know either. I didn't mute myself, so.
I think we have like our profanity filter set to strict, so it automatically muted you during the commercial when you're probably swearing at Mike Schaefer.
Yeah.
So what else is going on down in Madison?
Yeah, so we are super busy because it's budget time. And so we are in the process of trying to get our budget motions in, get them passed, get them in the final product so we can have an up or down vote. So we had a couple wins just last week. Pretty excited about. Earlier this year, I toured some of our fish hatcheries in northern Wisconsin. Mm-hmm. A fish hatchery in Brule. It's one of our oldest left in the state. And we have a fish hatchery up in Washburn and Bayfield, in between there, called the Les Boyd Hatchery. And so really cool facilities, family friendly. If you ever have an opportunity, take your kids, go up there. The one in Brule is very much like a park. You can walk around all the ponds and see and talk to the technicians on how they raise their trout and other species that go into our lakes and the Great Lakes. And then same with Les Boyd. It's an indoor facility. They've got a visitor center, great opportunity. But when I toured there, I was really puzzled by the fact that our facilities, not only are they run down, they are not operating at capacity. And so the Les Boyd Hatchery in Bayfield has been operating at 30% capacity for over a decade. And I said, well, why are you at 30%? We need more water. We don't pull from Lake Superior. We need a new well. I said, well, did you ask for a well? Well, no.
Well,
What? Like, do you just need more water and you can get 100%? Yep. Who is not asking for more water? Why are we running a facility at 30% for over a decade, right? I mean, the frustrations in government, right? So the problem is this facility also feeds Brule. And it's because Brule doesn't hatch their own fish. They all come from Bayfield, and they get planted in Brule to be raised. And so if Bayfield's down, Brule's down. So we have 2 hatcheries down because no one knew how to ask for a well. So what are we doing? So
problems are hard.
Yeah, life's hard. We asked for some monies to set aside for the DNR to come back with a plan and say, if you had the money you needed, how do we get these hatcheries back to 100% capacity? Because I even said, well, how many fish do we need? Well, the biologists only ask for this much because they know that's how much we can grow for them. I'm like, so they don't even give you a real number? No, because they know we can't do it. So they only ask for what we can produce. So I'm like, so it's not even a real number? No. I'm like, you can't make this up. So I'm like, where else does this happen besides our hatcheries in government? Where I don't know. I'll leave it at that. But we're trying to fix it. That's why we're here. And so we've got some money set aside for our hatcheries to bring those back to capacity. So I'm pretty excited about that.
When will that come to fruition?
So it's already been voted by joint finance. It's in the budget. And
nice.
Yeah, so my part's done. So as long as the budget passes, which something will pass, whatever that looks like, that piece is in there. So that's exciting.
Got it.
So we have that rolling right now. We've got funding coming up for our flood resiliency bill. And so we know up in our neck of the woods, during the last few years during these big events, we've had major rainstorms that have blown out roads, bridges, culverts, and we even lost Saxon Harbor. The harbor was just gone. It was blown out into Lake Superior by all this water. So instead of replacing the culvert over and over again, or the road over and over again, why don't we look upstream to say, where is this water coming from? And can we tweak the landscape to hold more water back before it ever gets down to our infrastructure? And so instead of spending $300,000 every time a road gets blown out, well, if I could spend $50,000 upstream to restore some wetlands and reconnect some of the waterways to where they used to be and slow that water down, does that make more sense? But we've never done that before, and there's no monies to do it. So our bill would do that. It helps townships, counties, municipalities map out where their problem is, and then give them the funds to say, go upstream and fix this problem. So it's a win-win. It restores wetlands, it enhances the environment, it improves water quality, and it slows it down and saves our infrastructure. So it actually will save taxpayer dollars in the long run.
So I have a question for you. So you're a politician, you're a legislator, but you seem to have a lot of logical and rational thoughts. How do you get elected? Because that typically isn't associated. Like, I would not associate those attributes to a legislator. Like, what could we actually do instead of keep replacing it? Maybe we just go upstream and go, It just,
right.
And plus, I mean, I'm glad that you're doing it, and maybe somebody brought that to your attention. But I kind of feel like that should just be someone else's job. I don't know who, but someone should have that job. I'm just surprised that Romaine Quinn has to jump in and say, well, you know what we should do? Like, nobody else thought of that?
Someone should have fixed the fish hatcheries 12 years ago.
Like, nobody else thought. I mean, good for you. No kidding. Great for you. And for all of us. But it's just weird that nobody thought of that up until now. Really?
Well, so the Wetlands Association have been kind of on this, and we actually tried to pilot this when I was still in the assembly. So we passed a bill that gave money for some pilot projects so we could come back and sell it to the legislature. Look what we did, and now how do we replicate that for every place that's prone to flooding? And so that's where we're at today. So again, trying to solve a problem that saves money at the same time.
It's a win-win.
So,
I love it.
Hoping for funding for that. That should be coming up. And then actually, as soon as we hang up today, I've got a hearing on another one of my bills to extend the prescription supply for those on senior care. So during the pandemic, there was a waiver through Medicaid that allowed everyone on Medicaid and senior care to get 100-day prescriptions instead of every 30 days.
Oh,
And
nice. I
so,
didn't know that. That's nice.
yeah, so it doesn't seem like a big deal, but I
No,
can
it's a
tell you,
that would be a big deal. Yeah.
yeah, so senior care, Wisconsin's one of the few states that has this prescription program just for seniors. And so what we want to do is say, we saw the benefits of having a 100-day supply,
Just keep doing it.
but don't have to go every month to get their prescription filled.
That's a
Why don't we
thing, man.
Yep. So I remember, I don't know how many times coming home from Madison, my mom would call me, "Hey, can you get to Osterbauer's and Rice Lake before it closes? Got to pick up grandma's meds and she runs out on Saturday." And so giving families and those people the flexibility to obtain the prescriptions that they already have for a longer period of time helps everyone, especially a population that mobility is an issue. And
Yeah.
so,
Is that one, you say you're having a hearing on that after this?
yep.
Is when you do these hearings, do you listen to do you have other people coming in? I'm assuming that's what, a hearing is.
Yep.
Who do you have coming in to advocate for this?
So in the assembly, they always tried to bring people down from the district to testify on behalf of it. The
Sure.
Senate doesn't have that rule, but yeah, so
Oh,
there'll be, I'm sure, disability groups,
sure.
senior advocate groups, others that will say, yes, this is a good idea. So it is a public hearing. So anyone from the state can come to committee this morning and say, you know what, this would impact me and my family. Please support this bill.
Mm.
And so I don't think it'll be controversial. But I've said that before.
Well, of course, that's what I was going to ask you again. Like I ask you all of these things. Is this one of those partisan? Everything has to be partisan to some degree, but this one also seems like that's a great idea, and it doesn't sound. I mean, that wouldn't cost any money, right? It's just
No.
yeah. So no, it seems like a logical or a good idea. And obviously, I haven't thought it all the way through. Maybe there would be some concerns. I can't think of what those necessarily are, but that seems like that should be everyone's kind of on board with that.
Yeah, I don't see any hiccups, and I don't see it
Okay.
as a partisan issue. No, and actually, it'll save us money because instead of paying a dispensary fee every month, it's every 100 days. So we could actually save taxpayer dollars while helping families get the meds they need.
I
So,
love this stuff. This is
right,
great.
not earth shattering, obviously, but
Well, that's
it
I think also important for people to understand that it's not just abortion, right? It's not just maps. There's a lot of other things that legislators actually do, and they not the things you see in national media or all the big stories, which those are certainly important. Not taking that away from that, I totally get it. But there's a lot of other things that we have to get done that kind of
exactly.
don't really get reported on, which that's fine. It is what it is. But this stuff is important, and I love hearing about these things because I never would have thought of any of that.
Yep. Yeah, and a lot of this work goes on, and like you said, it's not flashy, it's not sexy, it doesn't sell headlines, but if we
Yeah.
can continue to improve the situation, move the ball in the right direction, I think it all adds up. And I totally forgot. Besides the hatcheries, another one of our budget motions would, working with Representative Sappick, would sink monies into both Pattison and Amnicon Falls state parks.
Got it.
So we have lots of one-time money. We own these facilities. We own these parks. Why don't we make them look nice? And so
Yeah.
there's been a long time since there's been investment up there. So I think we've got another 2.1 million to really upgrade and put a fresh face on both Amnicon and Pattison State Park up in our district as well.
All right. I just
That's
put this up there. I don't know if you know the answer to this. Aren't the meds cheaper by doing 108? I don't understand that. I mean, I don't know. I have no clue. I mean,
I don't think it saves. I don't think it changes like a senior's copays, et cetera. It'll all be broken out, for 100 days versus 30,
right.
but it saves them the trip. And it saves the state the dispensary fee because the state is helping subsidize the cost for these low-income seniors. And so if we're not paying the pharmacist every 30 days versus every 100 days, it'll save us a few bucks too. So it's a win-win for seniors in our state.
And when is a lot of these things are going to be like in that budget? You had mentioned that before. Where is the budget process right now? When is this? Is it already been submitted? Is the governor and his team or whomever looking this over? Where is this in the process?
Yeah, so Joint Finance is meeting again today. Every time they meet, they'll take up a couple more departments and they'll vote things in or out. And then once those are in the budget, they don't revisit it. And so we have to work constantly down here to say, okay, what departments are coming up, what agencies are coming up, where are our budget motions in that agency, right? So we already went through DNR, so that's done. So if you came to me and said, hey, DNR needs this, it's too late. Joint Finance addressed DNR, what's in the budget is there. And so once they get through every department, then that will be finalized, it'll be drafted, and then we'll go to the floor and we'll have an up or down vote on the entire budget. And then obviously it goes to the governor, then he can line item things or throw the whole thing in the trash. I don't know, whatever he wants to do. And so that's kind of how that process is.
And where is that in that process? Are we looking at like a month away until all these meetings and all these here and all that stuff is finished, or is it further, or are we coming? It's already, May. Or,
Yep.
Oh, jeepers! It's almost June.
Yeah.
Where are we in the when is this going to be given to and finalized and given to the governor for his again, veto everything, approve everything,
Yep.
or line item veto things? What are we looking at here? A couple of weeks, couple of months?
So statutorily, our budget's supposed to be done by July 1. And so we will be done on time. But there's a lot of larger negotiations going on other issues like shared revenue, that drama that's been playing out in the news lately. That impacts the rest of the budget, what that will look like. So until we can button that up, it also makes it hard to decide where are we at on K through 12 schools, technical college, the UW system, etc.
Sure.
So everything's very fluid, but it'll be on time. So we should have a budget done by July 1.
All right. Well, that's our 45-minute time. That's usually about time we kind of wrap things up. Is there anything else, though? Certainly, it's if there's something else you want to talk about that we didn't get a chance to talk about it. Is there anything?
No, I think we covered quite a bit, and we'll have more good stuff next month.
Yeah, I think that's. I wrote it down. I think it's June. I don't know where it is. June something. 29th, maybe. You'll be back on. You're always on the last Thursday of the month. So looking ahead, what are we going to be talking about in 1 month on June 29th when you're back on? What do you think we'll be talking about? Will it be the budget, you think?
Yeah, by that point, I'm guessing we already would have had an up or down vote on the budget. I'm guessing. So we'll be right in the middle of that where we'll know everything that's in or out. And so there could be a lot to talk about.
Yeah, well, if that is the case, then that'll pretty much be the whole show.
Yep.
Next week. And I may actually have to do a little bit of research this time.
You're good.
Awesome. All right. And again, plans this weekend, Memorial Day. I know we talked about it at the very beginning, but I don't know. Well, are you coming back? Are you guys off? Like legislators off on Monday, I'm assuming, right? And you're back in the district, but are you doing anything personally?
Yeah, no, just those services. And I would encourage people to go out and attend one. I mean, we, at a minimum, we should remember those that paid the ultimate sacrifice. And there's some quotes flying around lately, and I just love it, where it's, be the American that's worth dying for, right? Be the American that is worth dying for our soldiers. So, at a very minimum, you take your family and you go out to those services and you pay your respects to those that paid the ultimate sacrifice. That's what this weekend's about.
Yeah, I especially think it's important for kids to see that stuff. Take your kids with to show that respect. Because we forget that stuff. It's all about memorial sales. And I was even asking, is there parades or something? Because I can't remember, the holidays, and that's stupid. The fact that I can't remember what's holiday and what is this about, oh, wait, duh, what an idiot, of course. But you just kind of get sucked into everything else, and you don't stop and actually think about it. So, yeah, very good point. Romaine, thanks so much, as always.
See you in a month.
Yeah, you got it, man. Special thank you to Wisconsin's 25th District Senator Romaine Quinn for joining us for our chat today. Remember, we chat with Senator Quinn on the last Thursday of every month, so we will be back on next month on June 29th. I'll see you on Tuesday when Barron County Sheriff Chris Fitzgerald and I will be back for our latest episode of Positive Tuesday with Ben and Fitzy. So until then, for DrydenWire.com, I'm Ben Dryden saying thank you for watching, and as always, have a blessed day.